Posterior lumbar decompression fusion is a surgical procedure used to treat patients who have just not responded to non-surgical treatment. Generally speaking, the patient has pressure on a nerve, and in most cases is causing either severe pain, numbness, or weakness in a very specific nerve root distribution, such as being able to lift or push off with their foot. In the case where this is severe and the patient has significant degenerative disc disease, we can go in, and I generally am able to do this in a minimally invasive fashion. In some cases this isn't possible, and we do it the old-fashioned or open way. But either way, we're able to take the pressure off the nerve and then stabilize the spine by placing an implant between the vertebral bodies to fuse it, to cause it to grow together and become stable. By getting the pressure off the nerve, we generally can either stop, reduce, or eliminate the leg pain, and by fusing the bones together and eliminating the motion at the offending level, we can reduce or eliminate the back pain. These days, with minimally invasive fusions, we're able to do them through smaller incisions, but more importantly, with less muscle damage. Instead of peeling the muscles off the bone, which was done classically, I'm able to make what's called a Wiltse incision, or an incision that's well off midline, typically about 3.5 centimeters off midline, and go in between the muscles directly down to the area where I want to work, without having to burn the muscle off the bone. It's really, in my opinion, the burning of the muscle off the bone that leads to the pain and long-term disability that patients experience after having an open procedure. And so it's not really the size of the incision that makes the difference. I believe it's the fact that you're preserving the muscle, you're preserving the posterior structures, including the posterior spinous processes and interspinous ligaments, which result in increased stability. And in my hands, I've seen a great reduction in blood loss through this minimally invasive smaller incision. Patients generally get off pain medications more quickly, they get discharged from the hospital more quickly, and overall, at least in the short term, seem to recover more quickly. So if you've had injections and therapy and medications and continue to have severe pain, weakness, or disability from your lumbar spine, you may be a candidate for minimally invasive decompression and fusion.